My name's Miss Nung Rudarakanchana, and I'm going to be talking today about varicose veins. So I'm going to talk you through the causes, diagnosis, and treatments available for varicose veins. So what are varicose veins? Well, varicose veins are bulging, enlarged surface veins that predominantly affect the legs because, of course, when we stand up, the leg veins fill with gravity. Veins are the return pipe for blood. So normally the veins in our leg are taking blood from the feet back up to the heart. But all veins have valves in them that simply look like this. And these valves stop blood flowing down with gravity when we stand up. But about 1 in 3 to 1 in 4 of us have faulty valves. Normally, this is something we inherit from someone in our family. When the valves are faulty, blood is able to reflux up and also back down the leg. And over time, this causes the veins to swell or bulge out. And these clusters of twisted veins, which come close to the surface of the skin, are called varicose veins. So is there a way to prevent varicose veins? Well, unfortunately, if you do inherit a problem with the valves, it's difficult to fully prevent varicose veins, but you might be able to slow the progression or control the symptoms with some self-care maneuvers. So things like leg elevation when possible, taking regular exercise, and having a good diet can help. Compression stockings physically hold the varicose veins in and can help some people with symptoms. But unfortunately, most patients find these difficult to wear on a daily basis, quite understandably. However, once varicose veins are established, they won't go away by themselves, and some sort of surgical intervention is often indicated. Varicose veins can have a severe impact on one's quality of life, both in terms of physical symptoms, but also affecting one's mental health. And I say that because I see quite a few patients who are too embarrassed to show their legs and will avoid particular social situations because they are ashamed of showing their veins. And this can lead to a significant impact in quality of life and social interaction. So I'm actually a big believer in treating varicose veins so that people can feel comfortable wearing skirts again or going swimming, for example. Now, in terms of physical symptoms, varicose veins can lead to heaviness and fatigue in the legs, swelling, and even pain or discomfort. Quite a few of my patients report restless legs, particularly at night, and even leg cramps whilst walking. At worst, varicose veins can lead to swelling such that the skin is stretched and becomes itchy, developing something called varicose eczema. Ultimately, the skin can become very inflamed and discolored, and wounds can develop, and we call these venous ulcers. So what treatments can I offer you? Well, if you have reflux in the main trunk veins, such as the great saphenous or small saphenous veins, these veins can be closed using a technique called endovenous ablation. This is essentially a technique of delivering heat inside the vein to block the vein, and then the body simply reabsorbs the vein. So we don't strip veins anymore. The vein stays in the body, but is closed and reabsorbed, thus relieving the pressure in the veins. The heat in endovenous ablation can be delivered by a number of methods, such as laser or radiofrequency. I myself prefer laser because I think that it allows me to treat a wider range of venous reflux patterns. For the lumpy varicose veins themselves, there are two main options. The majority of my patients have something called foam sclerotherapy. That's a technique where we inject a chemical mixed with air via a very small needle directly into the network of veins. This sclerotherapy spreads through the network of veins and causes the veins to block off or clot off. And then the body simply reabsorbs these veins so that by between 6 weeks and 3 months, the veins disappear. For some patients who have larger varicose veins, I might recommend something called avulsions. This is a technique where I make very small cuts, less than a centimeter each, directly over the bulging veins and hook them out. All of the modern vein treatments can be undertaken under a local anesthetic, and they're all walk-in, walk-out procedures. So you don't need any time off work, and recovery is very quick. I will ask you to wear compression stockings for 1 week following the procedure, but most of my patients are back to their normal activities and exercise within that first week. So overall, if you have varicose veins, please do come to see me for an opinion. I'll examine you, perform an ultrasound duplex scan for you, and tailor a personalized treatment so that we can address those symptoms that you're getting from your varicose veins and also improve the look of your veins so you can regain your self-confidence and be happy to show your legs.